Hi everyone. So I'm going to talk about a human body lesson, a pathology lesson. This is more related to healthcare than everything else. So we're going to teach and simplify a medical condition. So this is actually geared more towards healthcare professionals, nurses, people who really are not familiar with understanding certain disease processes, and it might actually help them to navigate a patient care better. I was going to say this, probably doctors or so at the very beginning might help to understand them, but at some point, if you're a doctor, all this is going to be menial to you overall. People who have these diseases or have to deal with these diseases, you're going to get an understanding of the healthcare side of it, which means how we deal with it in healthcare, and maybe for you to help understand why you have these symptoms appear the way they do. And also to maybe be able to understand and catch these issues on the early side and fix it before it becomes an actual problem. So one of the biggest diseases that people have continuously asked about and had the most difficult time understanding is a diabetic condition. When you have diabetes, there's this one particular situation. It's called Diabetic KetoAcidosis. It is a condition that occurs because the body doesn't utilize insulin the right way. So we're going to talk about the gist of how if you're a nurse, if you're in healthcare, what that all means, how we fix it actually, and it's kind of like my take on it, and how it realistically needs to be fixed. So we're going to talk about diabetes first. What do we see with diabetes? And ultimately, the biggest thing is how your body produces and utilizes insulin. We know that as a diabetes happens as your body's ability to produce insulin decreases. So think of a normal person, somebody who has no diabetes. When you have too much sugar or carbs in your system, your body increases insulin so that it goes and is utilized inside your body the right way. It gets metabolized, and we're going to talk about cells, the very single unit that makes up the human body, and how that works here in just a second. So that's part of the equation, is that diabetes occurs because your body does not, or is not able to produce enough insulin. So your blood sugars are higher because if your carbs or your sugars are not being able to be utilized correctly, then your blood sugars will rise if you don't have enough insulin to put them in the right place. The other side of the coin is those cells, the actual unit that takes in the carbs and the sugars for a metabolism, your body's ability to produce work. If your cells are resistant to insulin, otherwise require more insulin or less insulin, it's pretty much a dynamically is dysfunctional, where insulin doesn't produce the effect that we want. Think of requiring more insulin to get the same amount of sugar in. Let's just say 10 years ago, before you were diabetic, your cells only required 5 of insulin to get sugars in. But for some reason, your cells now require 10 of insulin, which means what? You have to produce more insulin to be able to get the sugar in the cell, the same amount of sugar in the cell. So it requires more insulin. If your body's not able to produce that much insulin, then your blood sugars still go high. So we call that insulin resistance, and that causes your blood sugars to rise, which is one of the things that you'll see in diabetics, is that you'll have a blood sugar that's higher than normal. If you don't produce enough insulin, even if you eat the normal amount of sugar, carbs, your blood sugar will be higher than normal. Why? Because you still don't have enough insulin. So it could be an issue of insulin production as well as an issue of insulin resistance. So that causes high blood sugars. So what does your body do if you have a problem utilizing insulin or producing insulin? Your blood sugar rises, right? Well, first off, when your blood sugar rises, your body wants to get rid of that sugar somehow. It doesn't like blood sugars that are high. Think of a sugar. If it gets more and more sugar in your system, it makes your fluid, your blood in your body thicker and thicker and thicker. Think of sugar water, maple syrup, so forth. As you have, if it becomes sweeter, it becomes thicker as well too. So it makes it harder for things to circulate in your body. So as your blood sugars rise, technically it does the exact same thing. Is it measurable? Yes, we do something called a finger stick or a glucose monitoring, and we can see the blood sugars rise, and as blood sugars rise over time, it causes all these other complications as well too. That being said, let's stick back to the diabetic talk. So when your blood sugars rise, your body says, hey, I'm really thirsty. So what you'll feel as your blood sugars are high is the fact that you get really, really thirsty. And it seems that no matter what happens, so long as your blood sugars stay high, you can drink all the water in the world and you're still going to feel thirsty. Another issue that occurs because your blood sugars are high is that you're going to want to pee a lot. It's a mechanism for your body to try to get rid of the sugar, is to pee out the sugar, urinate the sugar out. So you'll pee a lot, you'll drink a lot, you'll pee a lot, and whatever it can filter out, it does to try to decrease that sugar. Your body, if it's unable to produce more insulin, then ultimately it's still going to send the signal to try to produce more insulin to try to get rid of the sugar, but if it doesn't, unfortunately, your blood sugars will continue to rise. Now, to look at how you get into diabetic ketoacidosis is this particular process of your body peeing out all this fluid, all this water. So it takes water to try to get rid of all this sugar. And it does, but not as well as being able to utilize it with metabolism. Well, the problem is sugar is the food for the cells. So your body gets into a state where sugar doesn't get into the cells for metabolism, and because of that, your body says, hey, the cells are saying, hey, I still don't have enough sugar in the system, so produce more sugar. When your body gets into pretty much starvation mode, otherwise not getting enough sugar where it needs to be, then what does your body also do? It tells your body to produce more sugar. You got the sugar there, but since it's not getting where it needs to be, ultimately your blood sugars are already high. Your body sends a signal to the liver to break down fat and muscle to produce sugar. This is something called gluconeogenesis. So whenever this happens, your blood sugar is already high, and now your body's producing even more sugar, so it even rises even further. Well, the higher the rise, so your blood sugars are even higher, it's going to make you more thirsty, and at the same time, it's going to make you pee out a whole lot more because it's just trying to get rid of that sugar because it's too high. At the same time, that breakdown of those fat tissue and those muscle tissues that it can break down through gluconeogenesis, it also has some byproducts as well too. So it has protein byproducts, and those protein byproducts, it's called ketones. Those ketones are very acidic as well too. So it changes the pH balance in your body, more acid in your body. Well, your body has a way of compensating for it temporarily by through your kidneys by producing something called bicarbonate. It's the balancing act to acid in your body is to produce bicarbonate to correct that, and it's done through your kidneys. So what happens next? So you produce the ketones, and you have diabetes, and your body's pH is dropping. Otherwise, the pH balance is becoming more acidic. That's why we call it diabetic ketoacidosis. If you don't produce ketones, or you're negative for ketones in your blood or your urine, or your body's trying to get rid of ketones through your urine as well too, then if you don't have ketones, you don't have diabetic ketoacidosis. You have a completely different, you have something that's very similar, but it's a non-ketone issue, and that's treated a different way. Similar, but slightly adjusted compared to how diabetic ketoacidosis is treated. So the big picture is all this water has to come from somewhere. Well, you can drink all the water in the world and it's just going to pass through you, but it doesn't hydrate your system, hydrate your body. Cells are plump because they are hydrated. They have plenty of fluid as well too. So the cells in your body, since they're not getting sugar in, and your body is trying to dump water, pee out the water, guess what? The cells itself are going to shift the water, the hydration on the inside, to try to compensate for all the water loss. So you're getting dehydrated in two different factors. One, the blood vessels, the fluid in the blood vessels, that's where all the water is going from. So as that fluid decreases in the blood vessel, your blood vessels get dehydrated. Now, as your blood vessels get dehydrated, what does your body do to try to compensate for that is to get the water from the cells instead and shift it into your blood vessels. So now your cells are getting dehydrated at the same time as starving at the same time. Is this a good thing or a bad thing? It's a bad thing. So as metabolism is unable to function, as your blood sugars rise, as your body's getting more dehydrated, what happens is circulation decreases to your kidneys, and your kidneys are unable to produce more bicarbonate to balance that pH anymore, and now your pH drops below 7.35. So the normal pH balance for somebody's blood is about 7.35 to 7.45. So it drops low, so you become more acidic. So when your bicarbonate levels in your body decreases past a certain point, literally there's no return. You get way too dehydrated because of that, and you all of a sudden are now in something called diabetic ketoacidosis. So how do you prove it? Prove it because you're diabetic, your blood sugars are really, really high because that vicious cycle that produces more and more blood sugars. Well, that's the diabetes. You see that in these patients and these people that have really, really high blood sugars. Surprisingly enough, even at 250, you can get into diabetic ketoacidosis, or 200, or whatever it might be, so long as your blood sugars are higher than normal. That lets us know that your body is trying to produce more sugar. Second of all is ketones, the presence of ketones in your system. That lets us know that your body has developed something called gluconeogenesis, otherwise your cells are starving. And the third thing is that when we check the pH balance of your blood, is that the pH is lower than normal. Pretty much you're acidotic, otherwise you have too much acid in your system. Diabetic ketoacidosis. That's the definition, and that's the easiest way of looking at it. So how do you fix it? So when you look at diabetic ketoacidosis, bottom line is it is severe dehydration that can actually be fatal to your system. So why is your blood sugars elevated, and how do we stop the ketone production, or how do we stop gluconeogenesis? It's really simple actually, is to make sure you put insulin in the system where it's needed. So when you start somebody on insulin, it will help to drop their blood sugars. How? The whole purpose of giving insulin is to not immediately drop the blood sugar. It's to start getting sugar to go in the cells, to provide nutrition for the cells, to increase metabolism so that the function of work, so the cells are not starving anymore. Because when the cells are not starving anymore, then they don't send the signal for your body to break down the fat stores and the muscle stores to produce more sugar. So we send the insulin in so that your body doesn't send the starvation signal, so gluconeogenesis can stop. So that's the whole purpose of insulin. At some point, the blood sugars will actually drop. The second side of the coin is to rehydrate. Otherwise, you're so dehydrated. How do you rehydrate somebody who is in diabetic ketoacidosis? So long as somebody's able to drink water, we can use the IV or so and give them IV fluids or so in a very particular way. The particular way deals with this. You have two main spaces, or all the spaces in your body are getting so dehydrated because the blood sugars are high. So I want you all to think of it from this perspective when it comes to high blood sugars in somebody who is in diabetic ketoacidosis. Say you have 2 cups of water, and one cup you have half of it full of water, and the other cup you have full of water. If you take one packet of sugar and you put one packet of sugar in each cup, so they're even amounts of sugar, just one packet each, and you mix it up and you test it, well, it's the same amount of sugar, but the full cup of water will overall be less sweet than the half cup of water. Well, people say, well, of course that makes sense or so, because it's more concentrated. Well, that's the way you have to look at it in your body with diabetic ketoacidosis as well too. If your body only has half the water, otherwise it's that dehydrated where it doesn't have a lot of water, the blood sugar seems higher than normal. So what do? We fill your body back up with water, and that will actually help to decrease the blood sugars itself. So realistically, the insulin drip, or the insulin that we utilize, regardless if it's administered in tissue or given through the IV, is to do what? To stop your body from sending the signal of starvation so that your body doesn't produce its own sugar. The hydration itself will actually drop the blood sugars as well too. So you don't necessarily need insulin to drop the blood sugar. If you get somebody hydrated, it will actually drop the blood sugar. The other benefit of insulin is whenever you administer insulin to somebody, it helps to rehydrate the cells at the same time. So it shifts water into the cells of the body, as well as helps to hydrate the blood vessels that has been continuously dumping water. Well, what do you say? Well, people say, well, if your blood sugar is still high, you're still going to want to pee it out. Yes, that's absolutely fine. But over time, as your body gets rehydrated, and your blood sugars drop, it will make your body overall want to pee less and maintain that hydration. Do we fix it right away? No, because what we want to do is slowly rehydrate everything, slowly get metabolism back to normal. Because ultimately, if you rush these systems, what you're not going to be able to do is hydrate the system very well. And I'll use this as an example. Say you are really dehydrated in your blood vessels. That can cause organ failure, otherwise not enough circulation to your organ. Well, if your blood sugar is 700 and you're still alive, and your blood sugar is now 600, you're still going to be alive so long as you're getting hydrated, so long as you're getting insulin. You'll be okay. People freak out because, hey, the blood sugar is still above 300, above 400, above 500. Is it dropping? Yes. Well, you are alive at 700. You'll be alive at 500. You'll be alive at 400 if you came in and you were alive at 700. So don't worry too much about the blood sugars. As the blood sugar trends show that it's dropping and we're showing signs that we're hydrating the person correctly, then ultimately those blood sugars will continue to drop at that steady pace. Why do we not want the blood sugars to drop really quick at any time? Is because if we have it drop too quick, that means we're shifting too much water out of the blood vessels and into the cells at one time, which means we can dehydrate somebody and cause circulation to decrease all of a sudden. Well, if you're so dehydrated that your carbon dioxide levels drop, that means your kidneys did not all of a sudden lost good circulation to it. We want the kidneys to have good circulation because it helps to maintain that pH balance. So as you hydrate somebody, your kidney numbers will show signs of improvement. Off of something called the chemistry panels, the metabolic panels, what you'll notice is something called a carbon dioxide level on it. No, this is not a gas. This is the methodology of being able to look at somebody's bicarbonate levels in their bloodstream. The serum bicarbonate level can be noticed through the carbon dioxide levels in somebody's chemistry. So what you'll notice is whenever somebody's kidneys are not functioning very well, don't get really good circulation, this number itself will be really low. Well, what is a normal? Well, normal bicarb levels are roughly anywhere from about 25 to 35, or actually, about 25 to 35 overall. Every lab has a different skew on it, but Everyone kind of knows that if your bicarb, your carbon dioxide levels on these chemistries is less than 16, less than 15, less than 14, whatever it might be, that your kidneys did not get good circulation. So we rehydrate somebody, get that circulation, and over time what you're going to see is that carbon dioxide level in that blood work start to rise. So as it rises, the body starts showing signs that it's going to fix itself. Your blood sugars will show signs that it's dropping. The rest of your chemistries will show signs that it's working. Your vital signs, the heart rate, the blood pressures will show signs it's normalizing. Now here's a ticker that nobody really notices when it comes to diabetic ketoacidosis that has been prolonged, that has occurred on somebody for a long period of time, and that is somebody's temperature. It's like, well, what's temperature, guys? It has everything to do with it, because it's a sign that this diabetic ketoacidosis has occurred for a long time. So think of it this way. We get sugars into the cell to produce metabolism. Metabolism, ATP production and destruction, all this work or so produces heat. It's one of the key mechanisms. Metabolism is a key mechanism to producing heat, keeping your body warm. Well, if you're in diabetic ketoacidosis and metabolism slows down so much, well, all that normal heat production begins to wane, or otherwise decreases overall, which means what? You can see these people at a very, very low temperature. Well, if they're at a low temperature, we can correct some of that and slowly raise their temperature by doing something as simple as administering insulin, getting that sugar into the cell and starting metabolism. Because once we start metabolism on somebody, over time, they will start producing more and more heat, which means their temperature will finally get back to normal. We don't want it to rise really, really quick, because it can also change somebody's vital signs. So the balance of it is to slowly cause these rises, so slowly stabilize these patients. Because if you cause your temperature to rise too fast, it's also going to cause the blood vessels to require more volume, otherwise more fluid, more hydration, so that it doesn't get dehydrated. So otherwise, it's a process where your body warms up, the temperature rises, and it causes something called vasodilation. Otherwise, the blood vessels get bigger. Well, blood vessels getting bigger when you're still dehydrated means what? It's going to make you even more dehydrated, and because of that, your blood pressure might drop a little bit. So it's something where you don't necessarily want to warm somebody to normal temperature immediately. If they're stable, or they're not showing signs of a lot of symptoms, you want to slowly cause blood sugars to drop. You want to slowly rehydrate, not slowly, but you want to hydrate them in a very particular way where their blood vessels stay very well hydrated, and you trickle the rest of the fluids into the cells. At the same time, you're trickling sugar into the cells. You stop that starvation mode, gluconeogenesis shuts down, and all of a sudden your blood sugars will drop. Well, whenever your blood sugars drop or so, and all these mechanisms get back to normal, the question is, how do you fix the rest of it? Well, you maintain that hydration. You go ahead and try to normalize blood sugars. If somebody is normalized at 180 or 150, you aim for that until you show that your carbon dioxide, your pH balance gets back to normal. So once you see that 7.35 or above, that's awesome. Once you see that carbon dioxide level get to about 24 or 25, that's great, because that means you're finally resolving the hydration side of it. The kidneys are finally getting good circulation. Technically, there is something called an anion gap. So when you hear about diabetic ketoacidosis, one thing is to close that gap. Otherwise, the anion gap, when you close the gap, that's saying, hey, I finally got my patient rehydrated the right way. Diabetic ketoacidosis is finally resolving because their body is not producing ketones anymore. Their circulation is back down to normal. Their pH balance is normalizing, as well as their blood sugars are normalizing. Normalized blood sugars doesn't mean you have a normal blood sugar. So just because your blood sugar is 180 or 200 or 150, it does not mean that that they're still needing more insulin. It probably the insulin that we're giving this person is doing its job absolutely fine. Do we want them at 100? Depends if they can tolerate it or not. But the fact is, you'll notice as your vital signs improve, your heart rate will go back down to normal. The kidneys will start producing urine the right way, and at even 100, they're all of a sudden not urinating so profusely. They're starting to not feel so thirsty as well too. At this point or so, this is the point where when they close the gap, is appropriate to feed somebody, allow somebody to eat and all that as well too. Because ultimately, when you're in diabetic ketoacidosis, you don't necessarily want to give somebody a lot of food, because what is it going to do? It's going to cause their blood sugar to rise. And if their blood sugars rise because of food, what is going to happen is their body is going to try to continue getting rid of fluid from their body, so it causes further dehydration. So safety-wise, go ahead and make sure somebody's rehydrated. Get out of diabetic ketoacidosis first. Make sure those issues are resolved before we cause a blood sugar rise again because of food or nutrition of any sort. While hydration occurs on somebody, as we rehydrate somebody, let's talk about the chemistry side of it. Well, when you dilute everything, so your blood sugars drop because you dilute it, well, as your body uses insulin and starts metabolizing, it's going to start utilizing potassium as well too. It's going to start utilizing phosphorus. It's going to start utilizing magnesium. All these chemistries that help to maintain the function of your body, help the mechanisms move the stuff in your body, they're being utilized. So they're going to be depleted at the same time. So consistently making sure that somebody's potassium level does not stays normal as well too. Well, what does that mean? In these particular situations, because somebody has peed so much, they have peed out all that extra potassium, have utilized more potassium because we're giving them insulin, because insulin will help to shift not only water, but potassium into the cells, phosphorus into the cells, stuff like that. Your potassium levels will drop. So make sure that we watch for the potassium level on somebody, because as it drops, we need to make sure there's plenty to replace it. Magnesium, the same way, is as somebody's hydration resolves, magnesium is utilized more. So you're going to see magnesium levels drop as well. Make sure those numbers are normalized. One of the biggest things that happens is phosphorus is one of those things that has to be checked on when we're trying to resolve diabetic ketoacidosis. And the reason why is because it is necessary for metabolism to occur. How important is it? Well, it's extremely important, because if you don't have enough phosphorus in your system, then you cannot produce the mechanisms for metabolism. If you don't have phosphorus, something called adenosine diphosphate, you have to make adenosine triphosphate, ATP. So if you guys remember the Krebs cycle, we talked about ATP production. Well, ADP, otherwise adenosine diphosphate, turns to adenosine triphosphate. You have to have that extra phosphorus. You have to have one more phosphorus to produce that. Well, if your whole body is trying to produce ATP, trying to increase metabolism, your body is going to need a lot of phosphorus. So all of a sudden, your phosphorus levels will deplete. Well, if you can't consume enough nutrition to make that happen, then that has to be replaced one way or the other to protect the person. So ultimately, these mechanisms need to be monitored as well too. If good nutrition isn't consumed, well, if it's consumed okay and those phosphorus levels, magnesium levels, potassium levels are doing good, great. Calcium even is extremely important. So if you see significant changes in somebody's calcium and they're not consuming enough calcium, then that needs to be replaced as well too. Now, people are like, well, your body has a mechanism of producing calcium and phosphorus by breaking down your bone. Very slow process. And that's the key thing, is those slow processes do not work to quickly fix up a patient. What do you got to do? You got to replace them one way or the other. We have pharmacological or medication interventions to be able to do that. So when you get into diabetic ketoacidosis, as you get hydrated, you're diluting out all these other chemistries inside of your body as well too. So they become less and less overall through these levels, and they have to be replaced. Once hydration is done, once the pH balance gets back down to normal, once your bicarb gets to normal, once your anion gap closes, then your body has proven to the point where the hydration has gotten pretty darn well. And as a person gets back to oral sustenance, they're able to drink fluids and water, okay, they can do the rest of the hydration so long as their blood sugars stay managed. So ultimately, that is the gist of looking at diabetic ketoacidosis. Like I said, it's not necessarily dropping the blood sugar. It's priority one is to not worry about the blood sugar, but it's to hydrate the person, because that's what's going to kill a person quicker, is they're getting dehydrated. Dehydration causes a lack of circulation at some point. If dehydration gets really, really bad, at some point it causes a lack of circulation to every part of your body. So you will notice, and they say fruity breath or whatever it is. These are mechanisms that tell you that this person is trying to get rid of sugar. If they're peeing a lot, well, if you notice their skin is like, it feels very, very dry and scratchy. Their heart rate is elevated. Their heart rate's really, really high. They're feeling a little loopy or whatever it is. It's probably, under the diabetic side, is their blood sugars are rising, and if it's not caught early enough or managed well enough, that they're starting to go to the process of diabetic ketoacidosis. It is deadly in the sense where over time, every time this occurs, this lack of circulation harms the major organs in your body, causes harm to your heart, causes harm to your kidneys, and so forth. In the long run, what does that mean? It means dialysis on the kidneys, or your blood pressures are high, or you go into heart failure. So it's very, very dangerous if it cumulatively occurs over and over again. And the other side of the coin is, as your pH balance drops, can your body compensate for it by breathing out the extra acid in your system? Well, if it can't compensate for it that way, then at some point your pH drop will cause somebody to go into a coma as well too. Otherwise, they become non-responsive because their pH change is that bad. They have such a lack of circulation even to their brain. So a diabetic coma can occur as somebody gets into a diabetic ketoacidosis. So those are circumstances that you have to look upon. Temperature changes can occur. You'll notice this. Blood pressure drops can occur. pH balance, you will notice. Ketone production, draw blood work, look at somebody's urine, and if they're positive for ketones. If they are diabetic, their blood sugars are high. They're acidotic, they're in diabetic ketoacidosis. The earlier that the hydration is addressed, the better outcome somebody will have, because the sooner we get somebody hydrated, the better circulation we will get to their organs, their major organs. So that takes priority over dropping somebody's blood sugar. If blood sugars continue to rise as you're trying to hydrate somebody, what does that tell you? That means we probably need to be running more fluids or so, or trying to hydrate them even more aggressively until we can get that balance. Or maybe what it means is we might have to increase the amount of insulin we give to somebody. Realistically, it doesn't require a lot of insulin to get your tissue to stop starving and get sugar into your tissue. As sugar gets into your tissue and metabolism starts again, realistically, your body's going to say, I'm not starving anymore. And that signal to produce more sugar by breaking down fats and proteins is going to go away. So gluconeogenesis ends whenever diabetic ketoacidosis is resolved. No more starvation signal. So those are the mechanisms. So hopefully that is a helpful understanding, simplified understanding for new nurses or people who just want a simple review of how to look at diabetic ketoacidosis in a more simplified way, as well as maybe educate people who are diabetics to be able to evaluate their circumstances, and as they notice these things, is to seek medical help or healthcare help so that these things don't get so out of control. Thank you for watching this video.